Welcome back to the channel. My name is David Osuji, your psychiatric mental health nurse practitioner. And today, the topic of our discussion is Beat Anxiety Fast, How Beta Blockers Can Calm Your Nerves. Have you ever felt so anxious before a presentation that you felt like your heart was going to just explode out of your chest? What if I told you there was a way to calm those nerves without feeling foggy and like you are sedated? And what if you could still feel the adrenaline rush without the overwhelming physical symptoms of adrenaline rush? By the end of this video, you'll understand how beta blockers can help you stop anxiety in its tracks, especially when you need that quick relief. Now, let me tell you a quick story that introduced me to the idea that beta blockers work for anxiety. And honestly, the first time I heard this, I died laughing. This was before I went back to school for my master's in psychiatry. I was working in the neurosurgical ICU as a nurse supervisor, and we had a patient who just had a massive stroke. She was agitated and intubated. Intubated means you have a tube in your mouth to help you breathe, basically life support. And she needed to be sedated rather quickly. We called the resident for medication and he prescribed Labetalol, a beta blocker. I couldn't believe it. I say, Labetalol, that's for blood pressure, not sedation. I called the resident back, thinking, you got this all wrong. But no, he went on to explain to me that research shows that beta blockers can reduce anxiety by blocking the body's adrenaline response. I was like, sure, I can see it. I can make that connection. But this situation seems too urgent for this unconventional treatment approach. So I escalated the issue above him to his attending provider. And guess what? The attending provider prescribed us the regular medication for sedation, propofol. So later, when everything calmed down and we were sitting around the nurse's station, we laughed for hours about the residents who prescribed Labetalol for sedation. But this resident's idea stuck with me. Now, as a practitioner, when I look back on that story, using a beta blocker wasn't wrong. It just wasn't right for that specific case. It made me think about how we have a toolbox with a bunch of tools, but you have to use the right tool for the right job. In certain situations, beta blockers might actually be the perfect tool, but it was not for that patient. Now, before I get into this video, since we're talking about a medication, here's a quick medical disclaimer. The information I provide today in this video is for educational purposes only, and it is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a licensed healthcare provider before starting or changing any medication or treatment plan. The content I discuss in this video is based on general information and may not apply to your specific situation. Viewer discretion is advised when applying any of the concepts discussed. So, let's get into it. And first, we'll start with the basics. What exactly are beta blockers? Think of anxiety like slamming on the gas pedal. Beta blockers act like brakes, slowing your body's stress response. More specifically, they block the effects of adrenaline, that hormone that surges through you during stressful situations. Normally, adrenaline helps us in dangerous situations, think fight or flight. But when you're feeling anxious before a speech or during an interview, just in that stressful moment, that adrenaline that your body releases can make you feel even worse. Beta blockers helps turn the volume down on that stress response, reducing the physical symptoms like a racing heart, sweaty palms, shaky hands, nausea, and so forth. There are two types of beta blockers. There's the selective beta blockers like metoprolol, which mostly affects your heart. And then there are the non-selective ones like propranolol, which affect both your heart and your lungs. If you have asthma, non-selective beta blockers might not be for you because they can worsen the symptoms of your asthma. Now, here's how beta blockers can help you with anxiety. Anxiety presents in two ways. There's the cognitive part, which is the part in your brain where your thoughts are racing and you can't seem to think straight, or you feel like your mind is blanking out. Then there's the physical part of anxiety caused by the release of adrenaline, where your heart's racing, your hands are shaking, you're sweaty, you're nauseous, and you're restless. Beta blockers help with the second type, the physical manifestation of anxiety. They slow down your heart rate, which lowers your blood pressure, and then calms down the other symptoms of anxiety by essentially turning off the fight or flight response. Think about it this way. There are some states that your body enters into that will trigger a cascade of other responses. For example, if you started running right now, your breath will quicken, which will increase the rate at which your heart is pumping. This would trigger signals to the brain and body that, hey, we are in fight or flight mode. And that triggers other responses. The body doesn't need to know the context. Whether you're running for your life or you're about to walk into a job interview, it just follows the script dictated by the chemicals being released and the mechanical processes. So, beta blockers, when introduced, they pump the brakes on the fight or flight mode and the cascade of events that follow by slowing down the heart. This helps with anxiety by allowing you to stay focused on the moment rather than being distracted by your body's adrenaline response. Like I mentioned in the story, beta blockers aren't a cure-all, but they can be incredibly effective in specific situations, like performance anxiety. If you've ever felt your heart racing before a big speech or an important meeting or an interview, that is where beta blockers can shine. They help you by shutting down the body's adrenaline response so that instead of being shaky and sweaty, you can focus on delivering your message. While beta blockers offer quick relief, therapy approaches like CBT works to rewire your brain and how you think about stressful situations. Medications in the antidepressant class, like Prozac, Lexapro, Zoloft, are the mainstay treatment for long-term anxiety management. Lifestyle changes like improving your sleep, dieting, exercising also reduce overall anxiety. Before jumping into beta blockers, make sure to consult with your doctor first. Side effects like dizziness, fatigue, low blood pressure, sexual dysfunction are possible. And if you have asthma or COPD, beta blockers can make your breathing worse. And finally, beta blockers do not treat the root cause of anxiety, they manage the symptoms. They are designed to be part of a larger treatment regimen, not necessarily a standalone solution. In conclusion, beta blockers are great for short-term relief of anxiety. I like them a lot because they help reduce the physical symptoms of anxiety without making the person feel sedated or foggy. So they are perfect for public speaking or interviews or just any situation in which you can anticipate the anxiety that will happen and then take the medication about 15 to 20 minutes before the situation that can trigger an anxiety. Remember, beta blockers are just one part of a broader anxiety toolkit. So, what is your experience with anxiety? And have you tried a beta blocker before? Let me know in the comments. And if you have found this video to be helpful, subscribe to the channel and share it with somebody who you think might benefit from it.